There are many things that this pandemic has made clear. It has exposed the deep inequalities within our society, and it has highlighted that it is the labour of working people that keeps society going. But perhaps more than anything else, it has shown the value of our NHS and its staff. NHS doctors, nurses, cleaners and porters have been incredible through this pandemic, tirelessly working on behalf of us all to defeat the virus. Their courage and determination deserves huge thanks and recognition, so I want to begin by paying tribute to NHS staff at University Hospital Coventry and Warwickshire and across the country. Thank you for all that you do. But, Chair, I know that thanks alone isn't enough. NHS staff deserve much more than that. In the spring, in response to the public outpouring of support for the NHS, the government announced that parking would be made free for staff during the pandemic. It said, and I quote, "NHS staff should be able to carry out their vital work without worrying about paying for car parking." It further said that it would provide, and again I quote, "the financial backing NHS trusts need to make this a reality." This was, of course, welcomed by NHS staff across the country. So far, so good. The pledge has been regularly repeated by the government ever since. In July, the Prime Minister told the House of Commons on the 8th of July that, and again I quote, "hospital car parks are free for NHS staff for this pandemic." Last month, the Health Secretary again repeated this, telling Good Morning Britain viewers that we don't have parking charges in English hospitals and we're not going to for the course of the pandemic. This all sounds well and good. The only problem is, well, it's not true. And it hasn't been true for many months. Because as far back as June, parking charges were reintroduced for NHS staff at University Hospital Coventry and Warwickshire. Ever since, they've been made to pay for parking. Similar things have happened at NHS trusts across the country. Charges were brought back at nearby University Hospital Birmingham and at South Warwickshire NHS Trust. And they have been in places as far afield as Harrogate District Hospital and Wye Valley NHS Trust. And even now, as the second wave puts renewed pressure on NHS staff, charges are being reintroduced.
We don't really give way on that point.
Yes, I will.
I think I don't really for giving way. And just to, as I said to the Minister and the young lady outside, in Northern Ireland, the first wave came of coronavirus, and the trusts and the health board did away with the charges. They then restarted them again after the COVID wave had passed by. And the second wave has come in, they're now reconsidering that again. And does the Honourable Lady feel that the examples that have been happening in Northern Ireland and elsewhere should indicate that there is a need to subsidise staff during the COVID-19 outbreak? Because very, very clearly, their work is a priority and it saves us all.
I thank the Honourable Member for that intervention, and I agree. We see in Scotland and Wales that staff parking is free because parking is free for everyone, and Northern Ireland also has shown leadership in this field, and I hope that our government here in Westminster follows suit. For example, as of today, it is reported that staff at the Royal Cornwall Hospitals Trust will again have to pay for parking. So it's quite simple for me and for many others that the government has promised free parking for NHS staff through the pandemic. It has promised funding for NHS trusts to make this possible, but unfortunately it has broken that promise. Parking charges have been reintroduced for NHS staff during a global pandemic. From clapping for carers, we are now clamping carers. Frankly, that's scandalous, and it's no way to thank our incredible NHS staff.
Am I good for any good work?
Yes, I do.
Thank you, and thank you, my friend, for giving way. Would you agree with me that our hard-working NHS staff that put their lives on the line every day, that are currently suffering because of anxiety and mental health, need to be supported in a better way than clapping and having the free parking reintroduced? Because I've heard that the increase is going up by 200%. Do you believe that this should be stopped? Thank you.
I thank my honourable friend for that intervention, and mental health of NHS staff is something I will touch on later, but the point that you make where some trusts are introducing parking and there are cases of a 200% increase, and I think that is absolutely scandalous and it shouldn't be the case. The government should provide enough funding to, one, cover the gaps over a 10-year decade that we've seen in terms of cuts to the NHS, and also I'm going to later on talk about increasing NHS pay, so there's actual rewards and recognition given to our NHS staff. Thank you. When I asked the Prime Minister about this in the Chamber, he promised to look into it and get back to me. I haven't heard anything since, so I will be very interested to hear the Minister's update today, because what appears to be the case is that the Prime Minister and the Health Secretary are so out of touch that they don't even know that this has happened. And this isn't just about the government failing to keep its word. It's about public safety and it's about basic fairness as well. Working on the front line, NHS staff are already more exposed to the virus. And as the Royal College of Nursing and Unison both highlight, travelling to work by car reduces the risk of NHS staff catching or spreading the virus. And so reintroducing parking charges makes that safer option more expensive. It also makes it more unaffordable for some workers. So in terms of public safety, parking charges must be abolished throughout this pandemic. And it's not just that. NHS staff are battling this virus day in, day out. Staff tell me how exhausted they feel, pushed to the breaking point by the pandemic. One nurse at the Royal Victoria Infirmary in Newcastle told me, and I quote, "We're exhausted, we're on our knees." She tells me that staff are acting outside of their roles, working overtime for free, and being redeployed across wards and positions to try and cover the gaps. Another tells me how frightening battling COVID has been, with consistent failures to provide NHS staff with proper PPE. A Sunday Mirror investigation found that healthcare workers needed almost 2 million days off for mental illness in the first wave, with doctors and nurses suffering from PTSD and more than 2,000 doctors quitting the profession since March. And tragically, we know that more than 200 health and care workers have lost their lives to the virus. And even now, staff are being forced to use repurposed bin bags as official PPE at some hospitals in the UK. So it's not a surprise that a BMA study found that nearly 3/4 of their members fear that they will be overwhelmed this winter. Nurses in Coventry tell me that morale is at rock bottom, but the stress and overwork that NHS staff are experiencing isn't new. It didn't begin with the pandemic. Instead, a decade of NHS underfunding and privatisation has left NHS staff being underpaid and overworked. Nurses and doctors' pay has fallen by more than 8% and 9% respectively since 2010. Many cleaners and porters are on less than the real living wage. Underfunding means that we now spend 22% less per head on health than France and 47% less than Germany. And it is within this context that NHS staff are already being battered by a government that has overworked and overstretched them for 10 years. And a deadly second wave is hitting our hospitals, and we see that our government has let parking charges be reintroduced. Can the Minister tell me how this is fair? One member at University Hospital Coventry in Warwickshire has told me that the move has felt like a kick in the teeth. She said staff feel totally undervalued and unappreciated. What would the Minister say to them? At another hospital, a student nurse has spoken out about how demoralising it felt after getting a parking fine after she worked a 13-hour shift. Another tells me, in her words, staff give and give and give and get nothing in return, not even a free place to park our car. While another describes how, and again I quote, he is incensed that we are expected to pay to park in the middle of a global pandemic. This, as he says, is happening while nurses are using food banks and are leaving the profession in their thousands. And problems with parking aren't new. I've been told how low pay and high parking charges have forced staff to quit the jobs that they love. And there are reports that parking charges could dramatically rise, with recent revelations showing that one NHS trust planned to rise charges for staff by 200%. Some NHS staff and trusts are some NHS trusts are under such financial strain that they feel they have no choice but to reintroduce charges. Staff tell me that underfunding has become so extreme that parking charges are used to subsidise frontline care costs, meaning that NHS staff are victims of what one healthcare worker described as a stealth tax, paying for the NHS twice, once through taxation and again through parking at work. While in Coventry, we have a private company running hospital parking, lining their pockets from the hard work of NHS staff. In the past, hospital parking charges have been justified on the grounds that abolishing them isn't feasible. Well, tell that to the people of Wales who abolished charges for staff, patients and visitors more than a decade ago. And if anyone thinks that there's something different or unique about England, and here we somehow can't abolish charges, well, that has been thoroughly debunked by the simple fact that for 3 months at the start of the pandemic, charges were abolished. So it's not a question of feasibility, it's simply a question of political will. The government just needs to find the will to intervene, to provide the funds for trusts, and to guarantee free parking, just like it said it would. In the spring, government ministers clapped for NHS staff. Instead of more empty gestures, today I call on it to give our NHS staff the recognition that they deserve. Start off by guaranteeing free parking for all NHS staff, and this time, make it permanent. That is the very least. And then it shouldn't stop there. Parking charges are an unfair second tax on staff, but they also are a tax on patients getting ill and on visitors seeing loved ones. So parking charges should also be abolished for patients and visitors too. We've seen NHS staff face a decade of falling pay, which the current pay deal does not compensate for. The French government has stepped in to give their healthcare workers a pay rise totalling £7.2 billion. Our government needs to do the same. So I call on the government to give NHS staff a fair pay rise, 15%, to make up for a decade of lost pay, and end the creeping privatisation of the NHS, which has seen resources taken away from frontline services and channelled to private healthcare companies. If the minister says there's no money for this, well, I'll tell him that your government has just found £16 billion for the military. So I say let's fund the NHS instead. Our priority should be welfare, not warfare. Chair, I will finish with a series of questions for the minister. Does the minister acknowledge that the government has broken its promise and allowed parking charges to be reintroduced during a global pandemic? Will the minister apologise to NHS staff for this broken promise? Will the minister urgently work to reverse this situation and bring back free parking for NHS staff in Coventry and across the country? And will the minister move on from empty gestures for the NHS and instead commit to free parking permanently, a fair pay rise, and the funding the NHS needs for the future? Thank you.